Well, I had a bridge in the upper part of my mouth, and unfortunately, one of the teeth that anchored it came apart. So I had to then consider what else I was going to do, and the idea of having a plate which required sticky stuff like polygrip to put it in was certainly not what I wanted, because I'd had that before. So I had to think of some other way to get my teeth back to where they were. Well, I considered what might be best, and talking to my son-in-law who'd had implants already, it became obvious that was the way to go. So I then approached my regular dentist and asked whether I could have implants. Oh, it's been wonderful, because the plate now fits perfectly and clicks onto the three gold rods fine, and it stays there. It's very, very firm, and now I can eat happily, and I don't have to use any sticky stuff, and it is very easy to take out and clean and put back. In fact, it's got to the point I don't even have to push it up, I just bite on it. Well, I did wonder about that. I took a deep breath, because I had never spent that kind of money on myself in my life. But I thought at this time of my age, I'm 85, and I thought it was probably about time I did, and why was I hanging on to the money? So, yes, it did cost quite a lot, but nevertheless, I felt it was a well worth it while investment, and I'm very glad I did it. Well, definitely I would say consider it very seriously. If you can afford it, it's worth the money, and it makes your life so comfortable, and things like eating and talking and so on are then much easier than if you have a plate, for example, which you have to stick in and keeps coming out when the sticky stuff gives up. So yeah, I would go for it if you can.